Stephen Portnoy is with CBS Radio News, and he is in the White House briefing room, which you can see on the right-hand side of your screen. We're waiting for that briefing today as well. It's going to be on camera today, Stephen. We're going to hear from Sean Spicer. Have we gotten any reaction yet from the White House on this delay in the Senate vote?
No, we haven't. In fact, Sean Spicer, as you may have been discussing, is on Capitol Hill right now inside that closed luncheon with Senate Republicans who we understand will be here at the White House. At least they've been invited to come in about 2 hours' time. So we're all here gathered together in the briefing room expecting what was advertised as 2 o'clock Eastern time briefing, not only with Sean Spicer, but also with the Energy Secretary, Rick Perry. It remains to be seen exactly what time this is all going to get underway, but Spicer told us just a few minutes ago that he was, in fact, on Capitol Hill and that we should look to Senator McConnell for more details on exactly what the Republicans have planned. But we have been reporting that the Senate Republican leader will not hold a vote on the health care proposal this week. It will be delayed until after the 4th of July recess, which means it's at least 2 weeks away. And the big question is, even then, will the votes be there? If the senators on the Republican side are coming here to the White House today, the question will be to what end? And what exactly might President Trump say to convince some of those holdouts who are hearing from constituents at home, in some cases from their governors, and as late as this afternoon from the Club for Growth, a conservative group that says that this is Obamacare light, that it doesn't do enough to lift Obamacare's onerous regulations. So you have moderates who are echoing the concerns of Governor Kasich that you heard Nancy Cortez speak about just a moment ago. He said at an event here in Washington today, where are those people supposed to go? The 22-odd million more Americans who the CBO projects would be uninsured by the year 2026.
What is going on behind the scenes, Stephen? What can you tell us? Because we know that the vice president is involved, the president is involved, the chief of staff is involved in trying to change those minds there. How much of a full court press has this been at the White House?
Well, the president has been getting involved. I mean, we're told he was on the phone through the weekend with Senators Paul and Lee, Johnson and Capito, all of them Republican holdouts. Just today, he had Senator Rand Paul of Kentucky here at the White House. Senator Paul tweeted after that meeting that it's President Trump who's willing to negotiate. The question is whether the Senate Republican leadership is willing to negotiate. And that is an interesting element to all this. I guess Senator Paul is looking to his fellow Kentucky Senator Mitch McConnell and saying, okay, sir, how are you going to help get us over the goal line? The White House has said that President Trump and his aides intend to offer technical assistance to help explain how the HHS secretary might enact these proposals, but otherwise we don't really know substantively exactly how deeply President Trump is getting involved in these negotiations. We do know that he spoke by phone yesterday with Senator Lee. The Utah Republican senator called the president, but following that conversation yesterday, today, Senator Lee said he would not vote to proceed onto this bill. So at the moment, as you know, Rick, there are not enough votes in the Senate to even move to begin debate on this piece of legislation in the Senate.
Stephen, you mentioned Senator Lee from Utah and Rand Paul, the senator from Kentucky, who was at the White House today. And he emerged from his meeting with the president saying that the president was open to drafting a better bill, to improving the bill as it stands right now. But it seems like there's such a difference of opinion in terms of what would make it a better bill, with Senator Paul and Lee and others saying that this, as you said, Obamacare light, that they want this to go further. And then you have the other more moderate wing of the Republican Party in the U.S. Senate that thinks that this goes too far. So where is the middle ground? Because we also have a president who says he wants a bill with heart.
And this is the difficulty in legislating this, right? Because you have no help from Democrats at this point. And the question would be, okay, no, if not this, then how might you build some kind of an agreement, a coalition perhaps? And that's one of the things that a lot of people in Washington are speculating. What happens if this effort fails? Will Republican leaders in the Senate turn to Democrats if Democrats are willing to try to hammer out some kind of an agreement? Because you will hear from Democrats, if you ask them, that they are just as concerned about some of the stability of the exchanges and the marketplace, given the fact that there's a great deal of questions in the markets about these cost-sharing subsidies, whether the Trump administration will continue to make them on a month-by-month basis, and those subsidies help pay for the cost of lower-income people and sicker people to have coverage. And it's those subsidies and whether they're going to continue to be paid that are not only the subject of litigation because the House Republicans have said that the Obama administration paid them without any congressional authorization. But you also have the lingering question as to at any point will the Trump administration stop making those payments? And what would that do to the markets? That's what's leading many insurance companies to say that they're not going to offer plans in a number of places. So Democrats say they're eager to work out some kind of an agreement, but at the same time, there has yet to be any substantive discussion between Democrats and Republicans. And if it's going to happen, I suppose it would happen in the Senate and not in the House. But where we are right now, the Republican leaders' plans to have this bill passed by the end of this week appear to be scuttled.